I'm a board-certified family medicine physician. I learned about Unicity International and the product we're going to talk about tonight, Unicity Balance, from an interventional cardiologist. What initially interested me was the fact that an interventional cardiologist was using the product with her patients to improve their lipid panels and also to help control diabetes. And she talked to me about the profound effect on weight loss, which, you know, is a difficult thing to treat at best. And, you know, as physicians, we say, well, you need to lose weight and exercise. Well, that's not particularly helpful to people, and it's nice to have a potential solution. So, and then I thought that it was pretty incredible that this nutritional supplement was actually listed in the prescription side of the physician's desk reference, which meant that it must have studies that prove the product does what it says it does. And so that's what got me looking in the first place. And then once I started delving deeper, I saw the validity of the science that's behind this product, as well as 11 others that are listed because of our product's profound effect on the treatment of that disease. So when I looked at those studies, read the research, I couldn't poke holes in the science. So let me just summarize for you very briefly what those studies show. And this is, you know, sit down and jot this down because you're not going to believe me when I get done, but a 30% reduction in LDL cholesterol, actually 31%, a 29% increase in HDL cholesterol, a 40% reduction in triglycerides, an average reduction in the hemoglobin A1C of 2 to 3 full percentage points, and an average weight loss of 6 to 10 pounds a month, which was incredibly exciting to me. And then they did a really interesting study where they took patients who were already maxed out on a statin drug, but whose LDL numbers were not at goal. Back when we actually had an LDL number to treat to, those recommendations have changed recently, but we were able to get a further 20% reduction in the LDL for patients already maxed out on a prescription drug for cholesterol. And that is phenomenal. That's just a phenomenal result. So Unicity Balance is an evidence-based fiber supplement that, like we've said, just treats every aspect of metabolic syndrome at once. The ingredients are fiber, a blend of 5 different soluble and insoluble fiber, which means it's very easy on the digestive tract. And it also contains polycosanols and phytosterols, which are recommended as first-line therapy for treating hyperlipidemia. There's a proprietary blend, as you can see, of polysaccharides that helps with fat loss and leptin and insulin sensitivity. We'll talk about that in further detail. Plus, there's a bunch of water-soluble vitamins, vitamin B and vitamin C, chromium and some other things. And then the chrysanthemum also helps with cholesterol. So as you can see, there are no stimulants of any kind, and it's just an incredible patented combination of products. And what I want to point out to everyone is that the studies that were performed were done on this formulation, not on individual components, and they extrapolate that our product might work in that situation. The studies were done on this actual product, and that's very important. That distinguishes us from other nutritional supplements. Now, we use the product as treatment for metabolic syndrome, and as I mentioned, it lowers the LDL 30%, lowers triglycerides 40%, raises the HDL almost 30%, 29%, and it decreases insulin resistance. Now, how does it do that? There's an amazing chain of reactions that happens here. The product you drink about 10 or 15 minutes before your 2 biggest meals, and it gels up in the stomach. So you feel a little full, so you might eat a little bit less. But more importantly, it coats the upper part of the small bowel and delays food from being absorbed. And what that means is that your after-meal blood sugar, your postprandial glucose, is 30% lower with a single packet of this product. That means that your postprandial insulin spike is 30% lower with a single packet of this product. That allows us to get insulin out of our bloodstream faster and allows us to burn fat between meals. But because most of us are in a state of overproducing insulin, we haven't been able to burn fat for years, because when insulin's in the bloodstream, our fat cell doors are locked into storage-only mode. And so it's not until we get insulin out of the bloodstream that we can actually be successful burning fat. If you look on the upper left, it increases satiety after meals because we feel full longer because our blood sugar isn't spiking as high. It lowers the glycemic index of our foods, and by not spiking our blood sugar as high, we don't crash as quickly, and that means that we actually sustain a healthy blood sugar longer, and we're not needing to eat between meals because of these high insulin levels and low blood sugar levels. So that decreases cravings as well. The other beautiful thing that happens is because, and if you see in the bottom left corner, it lowers the glycemic index of food, so our blood sugar response is lower. When fat cells, adipocytes, start releasing free fatty acids, they also release a hormone called leptin, which goes to our brain and tells us we're not hungry. So it has a natural appetite suppressant effect in addition to just helping you feel full longer. So once our brain senses that leptin, we think, gosh, we're not hungry. We can open our fat cell doors and keep burning fat. So it's just been a wonderful addition to my practice from all of those respects. And then it promotes healthy cholesterol levels. I think we have a slide coming up which will give us more detail, and I can go into the exact mechanism of those things. There it is. So the fiber, you know, I told you it gels in the stomach and coats the upper part of the small bowel. And what that means is it functions as a bile acid sequestrant. Now, our medical professionals on the phone know exactly what that means, but for those of you who would like a better explanation, what that means is that the bile acids that are secreted by the liver to help digest food get absorbed into the fiber and excreted out through the bowel movements, but you don't get nasty, oily diarrhea like you do with some of the prescription drugs that are also bile acid sequestrants. Because this is fiber, it binds up all that oil and fat, so your bowel movements stay normal. But what's the #1 ingredient of bile acids? It's actually cholesterol. So at the next meal, when you have to secrete more bile, your liver has to suck more cholesterol out of your system to make more bile acids, and then that gets bound up in the fiber again with your Unicity Balance, and it's this just healthy system that perpetuates the extraction of cholesterol from the system. Now, phytosterols, as we all know, as medical professionals, it blocks absorption of cholesterol from the food we eat in the intestines. It actually competitively binds with the transport mechanism that takes cholesterol from the intestines into the bloodstream. And so we can prevent that absorption. And once again, even though we're blocking fat, that fiber binds up the fat so bowel movements stay normal. Now, the polycosanols further help reduce the production of cholesterol by the liver, and chrysanthemum also helps the liver break down the bad cholesterol and remove it from our system. So there really isn't anything else on the market, prescription or otherwise, that can work on reducing cholesterol in all these different mechanisms, which is why it's such a wonderful alternative to prescription drugs. It is simple to use. It's a powder that comes in a packet. You dump it on top of about 10 ounces of cold water, shake it up down the hatch right before your 2 biggest meals of the day. It tastes great. Patients love it. And it has all of these wonderful functions. But more importantly, it has no side effects. It's fiber. And so, it's just a phenomenal product that causes no side effects. So I must have, 10 patients a day who tell me, I don't tolerate my statin drug, I can't take them, I can't go back on them because of muscle pain, joint pain. Sometimes the statin drugs cause liver problems. I actually have several patients who have been in full-blown kidney failure as a result of statin drugs, and they can't take these medications anymore but still have high cholesterol. So the beautiful thing about this is it's easy to use. Drink it right before your 2 biggest meals. Patients can take it anywhere with them because it's in a little packet. And it has no side effects. So compliance is very high because it's easy and they don't get all the aches and pains they do with the other medications. It actually has revolutionized my counseling of patients. For the longest time, we counseled our patients who are overweight to eat 5 small meals a day so that they never get hungry and they don't ever overeat. But what we know is that every time you eat, even if it's a relatively healthy snack, that spikes your blood sugar and that spikes insulin and that locks your fat cell doors. So it's actually, less productive to eat frequently. But if you eat on a regular schedule so that your body knows when food is coming next, it will keep its metabolism in a higher rate. You know, people who skip breakfast have a harder time losing weight because their body stays in its sleeping metabolism mode until you get food for the first time. This is, harks back to our hunter-gatherer days when our body did not know when the next food was coming. And so by eating on a regular schedule, we teach our body when food is coming, and that allows the body to burn fat between meals because the body knows it will be fed again and doesn't have to hang on to all of these fat stores. So my patients initially think there's no way I can only eat 3 times a day. I have to have my snacks. But what they find when they've been on Unicity Balance, even for just a couple of days, is that those cravings that were driving their snacks go away. And the reason they were having the cravings is because their insulin levels were high and their blood sugar was low. And in that situation, you can't burn fat. So your body was saying, I have to have glucose, eat something. And so those cravings were impossible to overcome. Your body is driving you to do it. But because Unicity Balance lowers those insulin levels so dramatically, the cravings go away and the product makes it very easy to go at least 4 hours, and then at least 12 hours between meals.